This video is for you if you find yourself just going about your day normally, but all of a sudden when it's time to sleep, you put your head on that pillow and you cannot breathe through your nostrils. It feels like you're suffocating. I have a very simple solution for you that involves just breathing. And I know it sounds like I'm telling you to just breathe, but I'm not. I have a breath work technique to teach you that can really help. It's simple, it's free, it's accessible, and it will work in minutes, maybe even seconds. So stick around and I will teach it to you. Of course, there are other things that you can do if you have chronic nasal congestion, which you might have if you have chronic allergic sinusitis or rhinosinusitis, which is inflammation of the nasal passages and the sinus airways. Or vasomotor rhinitis, which is not really allergic in nature, but just changes in temperature or everyday triggers can cause you to have nasal congestion, which isn't necessarily mucus blocking it, but just the nasal mucosa becoming more congested, like blood just fills it up and then all of a sudden you can't breathe. This breath work technique will really work for that. If you're clogged up because of an acute illness like a respiratory illness like the cold or the flu, this will not work as well. There are other things that will work better, and I'll get into those later on in the video. But I'll start by teaching you the breath work technique that works really well if you have a chronic nasal congestion issue. So I didn't develop this technique on my own, but I put them together on my own because I'm somebody who struggles with chronic nasal congestion. And I also have a very itchy nose. You might notice I'm always just scratching my nose in my videos. My friend was watching my video and she asked, "Are you itching your nose because you're nervous?" No, it's because it's itchy. I don't know why. Anyway, so I combined two different breathwork techniques that I learned about to help with my nasal congestion at night. And the whole concept of it is that these different breathwork techniques, they're helping to induce a parasympathetic state. If you're sort of familiar with the nervous system, or autonomic nervous system has two main branches, the parasympathetic and the sympathetic state. Sympathetic is fight or flight, parasympathetic is rest and digest. So when you're sleeping, you want to obviously be in the rest and digest mode, and that involves breathing through your nose. Sympathetic breathing happens through the mouth. If you think about it, when you're in the wild running from a predator, you'll need more air, more oxygen going to your muscles, and so your nose becomes, your nostrils become congested, and you automatically start breathing through your mouth to get that much more air in. So sympathetic breathing is through the mouth. We don't want to be doing that on a regular basis, and definitely not when we're going to sleep, because we want to be in the rest and digest mode if we truly want to rest and heal properly. So these two breathwork techniques help to induce that parasympathetic state. The first one is the 4-7-8 breathing technique, and this was popularized by Dr. Andrew Weil, the founder of the Andrew Weil Center for Integrative Medicine, which is where I'm doing my fellowship in integrative medicine. So this is very common among the fellows. We are taught it from very early. We're taught to teach our patients it as well. And it's a pretty simple technique to do. And the whole concept of it is that you are lengthening the ratio of the inhale to the exhale. So you want the exhale to be much longer than the inhale is. So how you do the 4-7-8 breathing technique is that you breathe in for a count of 4. Doesn't have to be 4 seconds. It could be more, it could be less, depending on how quickly or how slowly you count. So you get to choose how quickly or how slowly you want to count. So you breathe in through your nose for a count of 4, and then you hold that breath for 7, for a count of 7. I was going to say 7 seconds. It's not 7 seconds. You hold the breath for a count of 7. Then after that, I think 4-7-8 breathing actually teaches you to breathe out through the mouth for a count of 8. So if you have nasal congestion and you're doing this for the first few rounds, it's okay to breathe out through your mouth for the first few rounds. It might be really hard to get the air in and out through your nose. So that's fine. It's fine to do in through the nose. Then you hold it and then out through the mouth for the first few. That might start to get you somewhere. You might notice a little bit of improvement with the congestion. Maybe if you were even to continue that for a little bit longer, you might begin to feel relaxed and you might begin to notice even more decongestion. So that's the first principle of this breathwork technique. You want to do the 4-7-8 breathing, where you're breathing in for a count of 4, just a regular breath, as regular as you can take it. Then you hold that breath for a count of 7, then breathe out in the beginning through the mouth for a count of 8, but then eventually, as soon as you can, try to do it through the nose. Then I compound on top of that another breathing technique, which is from the Buteyko method. I'm not Buteyko trained, but there's people on YouTube who are, and they teach you how to do the Buteyko method. It was popularized by a guy named Buteyko, and honestly, I didn't really look up much of the history. I learned this maybe 2 years ago, and I can't remember most of it from the top of my head, but I know the principle of why the Buteyko method works, and it works really well for patients with asthma. And anyone who has an issue with ventilating their lungs properly and getting proper air exchange. So what the principle from the Buteyko method that I stacked onto the 4-7-8 breathing, what it does is that it gets the carbon dioxide level in your blood to build up so high that you begin to feel a sensation of air hunger. And the reason why that works for ventilation and oxygenation is because the higher the carbon dioxide level is in the blood vessels, it makes it more likely for the hemoglobin molecules in your red blood cells to let go of the oxygen that they have. What am I call that in physiology? It increases. It either increases or decreases oxygen tension. You don't need to know the basics, the whole. Clearly, I need to go and read that over, whether it's decreased or increased oxygen tension. But the point is, the higher the amount of carbon dioxide is in your blood, the more likely for your hemoglobin molecules to let go of the oxygen that they have and are carrying around, which means that as your blood cells are carrying oxygen to your tissues, if there is more carbon dioxide in the blood, it will let off the oxygen into the tissues. So it helps with, something went into my eye, it helps with increased oxygenation. So that's why it works really well for people who have asthma and other chronic diseases as well. So the specific principle from the Buteyko that I apply to the 4-7-8 method is that you have to take such a slow, such a soft, sweet, imperceptible breath, like you're barely breathing, just enough air. Nothing extra, not a big sip, just slow, soft, sweet, subtle, as little as you can take, which will be different for everyone. You're taking as little air in as you need to take, which when you have nasal congestion, it does help because you're not trying to sniff in a bunch of air through a very clogged nasal passage. You're going really slowly, and therefore there's less resistance for the air that's coming in through the very small passage of your nasal airway at the time at which you're still congested. So it actually helps for air to get in more easily when you're going very, very, very slowly. So the air will come in easily. What won't feel easy is that because you're taking in the air so slowly, you will begin to feel what they call air hunger. So that is a sensation of, it's like a mild discomfort, or it can be a more intense discomfort that you get when the carbon dioxide level builds up so much in your body. It makes you want to take a gasp in. So when you're breathing in very slow, soft, sweet, subtle for the count of 4, you're gonna then hold for the count of 7. Now you've just taken in a very slow, small breath. You barely got any air in. Then you're gonna hold it for 7. the air hunger will begin to build. You'll start to feel the discomfort beginning to build. Then after that, you will continue with the 4-7-8 and do a breath out for a count of 8. So that breath out ideally should be through your nose. So a nice slow out breath through your nose. It's still congested, so you're doing a very slow breath to get the air out through your nose, not pushing too hard, because the nasal mucosa is already it's in the way. So the more you push out is the more resistance you'll meet. So you'll go very slowly with the out breath through your nose. Now this will create some sensations that might be interpreted as uncomfortable. The intention is not to make you uncomfortable, like very uncomfortable, but you might feel a small amount of discomfort. The air hunger itself is a little bit uncomfortable. You're not trying to make yourself uncomfortable for a whole 20 seconds. You're just going to get small, tiny amount of discomfort. Then you know, okay, I've built up enough air hunger. It's time to now release the breath. You can count the 8 a little bit quicker if you really feel like you need the next breath in. So I hope that was clear. I hope that was clear. It's 4-7-8 breathing. Breathe in for a count of 4, hold it for 7, breathe out for a count of 8. But those breaths, the in breath and the out breath, will be as slow and soft and as imperceptible as you can make them. You can adjust it for each breath depending on if you really need a gasp in. Like sometimes if the air hunger is too bad, you can just take a breath in and then you try again. Give yourself some air and then try again. 4-7-8, nice and slow, in through the stuffy nose, hold it, then nice and slow, out through the stuffy nose. As you do this, your nose will begin to clear. It will just magically, naturally decongest. And I first did this maybe like a year or 2 ago, and that was the only thing I noticed. Some people would do the Buteyko method and they say they get very warm in their body, like warm and tingly. I didn't experience that. But since doing somatic practice for more than 6 months now, some of the sensations that I notice in somatic practice that kind of signal to me that I'm going into parasympathetic downregulation, so more pulsations inside my abdomen, just very new feelings for me that I've only since encountered in somatics. Doing this breathwork technique with the Buteyko method, like stacked onto it, does create that same feeling. So that's how I know that it really is inducing a state of parasympathetic downregulation. But what's most important, especially I'm just trying to get to bed, what's most important is the sensation and the feeling of being able to breathe through my nostrils. So this works really well. At least it does for me. So I really want you to try it. If you have very windy. If you have a problem, is it getting very, I hope not. There's a wind muff, but I don't know how well that works. Okay, if you have an issue with congestion, I really want you to try this. I think it's relatively easy to do. I hope I explained it in a way that you could actually understand it and try it. And it should be straightforward for any adult to do. I haven't tried to teach this to a child. So good luck with that. If you try that, let me know if it works. But any adult should be able to do this. So to recap, it's the 4-7-8 breathing. You breathe in for a count of 4. You hold that breath for a count of 7. Then you breathe out for a count of 8. The in breath should be through the nose. The out breath can be through the mouth in the beginning, but as much as possible as you try to decongest, make both the in breath and the out breath be through the nose. And then stacking on top of that, the Buteyko method, you will take such a small sip of air. Oh, I forgot to say that. Sometimes I sip the air. Instead of doing one big for 4, I might do just like a slow, small sip, just to make sure I'm not bringing in too much air. You can do that too. You can sip the air slowly in through your nose. Lost my train of thought. I think I was saying The Buteyko is slow. You can do sips, soft, almost imperceptible breaths in and out. And while you're doing that, you'll begin to feel the air hunger building. That's a good sign. And then afterwards will come this very pleasant sensation of like warmth spreading in your body, coupled with the most important thing that we're here for, if you're here for this video, the nasal decongestion. Now, remember how I was saying earlier, if you're acutely ill, like you have a respiratory tract infection, this might not work as well for you because you have there's something there physically blocking it, like there's mucus. You're producing way more mucus if you have an acute respiratory illness in that moment. So what will be more important for you is you need to be doing nasal sinus rinses. You can get these on Amazon or in any pharmacy. You'll be rinsing your nostrils with salt water that will physically irrigate and flush out all the extra mucus. If you're acutely sick, you would need to do that multiple times in a day. There's just no way to get around that. If you're acutely ill, you must be rinsing. And then other things to consider if you're acutely ill to help with the comfort is an over-the-counter decongestant spray, something like Afrin, which is oxymetazoline. Is a really good decongestant and is good to make you comfortable if you're in the acute phase of something. It's not something I would recommend that you consistently use. Well, that's because you're not supposed to. You're not supposed to use it for more than 3 days straight because it can cause rebound congestion. But for acute illness, I would say it's really good. For me, it kind of burns my nasal passages, and it has a taste. But when you're sick and you really cannot get any air in or out, Buteyko or not, something like Afrin is really good. If you're not acutely ill and it's more chronic sinusitis, then it's much more safe to do this breathwork technique that I've taught you earlier in the video. It's much more safe, much more accessible, and it's free. And it will last, and there is no risk of any rebound nasal congestion. So I spoke about nasal sinus rinses, about an over-the-counter decongestant spray. Another thing you can consider is if you do have chronic sinusitis and you're having like an acute flare on top of that, your doctor might prescribe a steroid nasal spray for you, something like fluticasone. So you can use that in conjunction with the rinsing. So you rinse to get away all of the extra mucoid discharge, extra discharge that's in your nose. And then you can follow that up with your prescription steroid spray. That can help a lot when you're in the acute phase. And what else is there? On top of that, you can then add the breathwork technique if you're acutely ill. But I would say if you're actually sick and very congested and you can hear, like your voice is really congested and your head is like full of mucus, I wouldn't say that this breathwork technique should be used on its own. You need to physically like remove the mucus burden. And that's also the reason why I never recommend nasal spray on their own either, because you need to physically get all that mucus out, help it to get out. But if you are just somebody who randomly struggles with nasal congestion here or there, for me, I think it was because I turned on the air conditioning in my room. I live in Jamaica and it's very hot. I need the air conditioning on at night, and then I'll turn it off once the room cools down. But things like the air conditioning, the fan, things like that will trigger nasal congestion, either because it's vasomotor rhinitis or because of sinusitis. I don't know why. If it's not actually mucus that's blocking up the nasal passages, if it's just congestion, then this breathwork technique works. Miracles, wonders. So I hope that was helpful for you. If you have any other questions, like a specific question, I want you to tell me what it is in the comments. And if you try this and it works, I also want you to tell me in the comments, because I don't know. I don't know if this is a thing. I know the 478 breathing is a thing. I know Buteyko is a thing. But the whole reason why I did the two of them together is because I understood that a parasympathetic state will help with nasal decongestion, and a sympathetic state causes the congestion. I mentioned that earlier in the video. So I was like, okay, maybe if I do some breathing to help to induce a parasympathetic state, it will help with my congestion. And it did. So ouch, I just hurt my foot. I want you to try it, and I want you to tell me if it worked for you. And thank you for being here. I will see you in the next one.